Good morning, everybody. Again, my name is Gokce Sezgin, Head of Marketing and Patient Liaisons at the Clinic by Cleveland Clinic. The case study that I'm going to share today has some relevant topics for a lot of you, I believe. It is a virtual care or virtual healthcare, a telehealth topic, so it's not quite the crowd for that necessarily for that specific virtual care case study. So I wanted to share a little bit about how we go to market, how we position the product, how we make up our channels and related channel strategies. It is a little less about marketing, communications, advertising tactics, etc. You all know and have a lot more experience on that. I have very small budgets to go with, and therefore not the best case study for that one. However, a good conversation and learning about how you look at a marketplace and then work on transforming it into digital health, digital care delivery. My background is, I'm classically trained in the world of CPG, so a lot of my years was in the world of CPG, not pharma, but consumer health. I was in the oral healthcare business, worked on Sonicare toothbrushes for many years. Any Sonicare fans out there? You're my folks. Yeah. Probably a lot of the products, or the products you're using today, has my touch on them from a few years back. A lot of fun times. Back in 2012, after working in the industry for about 15, 16 years, I left the corporate world to go into the world of startups, scale-ups, not unicorns just yet, but maybe soon, who knows. Startups, scale-ups, relatively smaller, 100, 200, $300 million companies in the positions of leadership and executive team. I had the opportunity to work in weirdly different industries, from consumer electronics, like I said, to selling tea and margarine and fats and oils, and weird how it started. Thankfully, I don't do that anymore. Kitchen appliances, headphones, and things like that, a lot on the world of CPG, and then transferred that experience into the world of healthcare. And my recent couple of experiences have been more traditional healthcare delivery, working with healthcare professionals, and the one prior to this, and then working directly with consumers and also with the payer world. I would love to hear some experiences from some of you as I speak today about that in this current organization. I have a consulting business of my own. These two jobs are actually via this consulting business that I joined the team of the leadership team after they were my clients. It has been a great experience of lots of learning and sharing some of those experiences also, as I am a part-time marketing professor at Syracuse University and the University of Connecticut, teaching core curriculum MBA marketing courses, both marketing management and strategic brand management. So just putting all of that together, this case study is about, again, talking about a market category, but just a little bit about the company first. The Clinic by Cleveland Clinic. How many of you know Cleveland Clinic? I know Erin just mentioned. How many of you do not? Because I met a couple of people yesterday with open eyes. I'm like, you don't know Cleveland Clinic? It happens, but how many? I was one of those until about 5 years ago, so no shame in that. But like some Manhattan people, some West Coast people, you may not have been exposed to that brand very much, but like Erin said, Cleveland Clinic is the world's #2 hospital, 27 years in a row, and world's top cardiac hospital for just about that long, in the last quarter decade, if you will. Cleveland Clinic and Amwell are co-owners of the business. It's a joint venture between the two of them. Amwell is a leading telehealth platform. I don't know if you guys know Amwell. Show of hands. Amwell, the telehealth delivery platform. And they work with, Amwell works with more than 50 health plans covering collectively more than 100 million lives. And Cleveland Clinic is, again, one of the world's top hospitals for more than a quarter century. This is a joint venture established in 2019, end of 2019. First operation starting in 2020, and then taking off from there. I joined the company end of 21, and then it's been a joy to work on the growth of the business. A poll to those that were not in my little roundtable conversation yesterday, because I already shared this data. So a poll here, show of hands, or you can just blurt out the answer. What is the average number of days it takes for a new patient to get an appointment with a provider, especially a specialist? Okay. Good job, yes. But isn't that appalling? Isn't that hard to accept, understand? We had a case study yesterday, like, was it John or Steve? I can't remember. You went to the doctor and you wanted to be, that was you, right? So you wanted to just go be an acceptor right there and they're like, come on, we'll fit you, and it doesn't happen. So it's not only just for a terrible head cold, a cancer diagnosis, a heart disease issue, or even more serious problems sometimes, and you may not be able to see a specialist, a good one, for about half a year. And that is a challenge, especially when it becomes, you guys get the answer already. That's a challenge because specialty care deserts is one of the key reasons why this business exists. Cleveland Clinic physically can reach geographically nearby areas and thousands of people over there, but has a lot more capacity and willingness to reach more people beyond just telehealth appointments. And the way to do some of that was to share that healthcare expertise with the world via a second opinion. It sounds like an easy definition, but any idea what a medical second opinion is? Just blurt out an answer. Oh, by the way, I meant to say this earlier. I would love this to be an exchange, interactive conversation, and not just Q&A at the end, if I may please. So any responses to what a medical second opinion is? Right. Right, so you go to a second, in most cases, a second specialist to get a second opinion on a diagnosis or a treatment plan. Any of you have had a second opinion? You don't have to share what the issue was. Okay, a few. You're one of the, and the others, I hope the reason you did not get a second opinion was because you didn't need one, you were not diagnosed with something important, or you were not about to have a major surgery. But that's most of the time a reason for why anybody seeks a medical second opinion. But just even via that show of hands, I have another question for you. How many of you had to change a major purchase, a car, replace your windows, or boiler? That's the most annoying thing to think about every, 15 years or something. How many of you had to deal with something like that? And how many of you got a second, third, or maybe fourth quote on that one? That is not the same stats for medical second opinions in one of the most, or least, transparent industries, especially in our country, right? You don't know what you're getting into. You don't know what your diagnosis, you have not confirmed your diagnosis. You don't know if the treatment path in front of you is actually the right one, and if the doctor that you're seeing is the right person to administer that treatment path. A second opinion does just that. You reach out a second provider, ideally someone that is really, truly specialized on cases that is very similar to yours. Deep specialization so that you can get the best out of that second opinion. Here's an example I'd like to share. Leslie and team, Leslie here, CEO of Insana, is my media agency, PR agency, and they helped us get this coverage just about 12, 13 days ago. And it's a video that you can see this story ran on 60 markets, part of how we go to market and bring visibility to the product. So I'd love for you to watch this, which will give you a great idea of what the second opinion is or how it works.
Medical diagnosis can stop you dead in your tracks.
You know, it's like a gut punch.
Doctors in Mike Pressler's hometown said he needed major surgery to remove an advanced recurrent polyp in his colon. That meant cutting him open, leaving him with an ostomy bag.
My world collapsed at that point. You know, I'm active, I've got grandkids, I don't want to be tied down with a bag.
Searching for answers, Mike pursued a second opinion from the Clinic by Cleveland Clinic, which offers second opinions virtually. In just days, he got advice from doctors at one of the nation's top hospitals, and he did it without leaving home.
He goes, we have a surgeon here by the name of Dr. Gorgon, and if I'm quoting him correctly, he said he's one of few in the country that can remove this polyp robotically. Fantastic. Now, all of a sudden, I got hope.
And that's exactly what happened. Mike is healthy now and ostomy-free. The Clinic by Cleveland Clinic is a joint venture between Cleveland Clinic and telehealth company Amwell. The second opinion process is pretty quick. The clinic gathers your medical records and pairs you with a specialist who reviews your case and provides a second opinion in a few weeks.
The Cleveland Clinic changed my life in the fact that it restored my faith in how well the healthcare system can work.
That's a great case study in itself in terms of how it works. And it just speaks to the strength of the proposition, and then it comes to the marketer to be able to market it to the business overall, to be able to create a clear, specific, concise, non-fluffy, again, the team that we discussed in the roundtable yesterday about non-fluffy communications, to have the simplest, most easiest one-sentence explanation of what you do as much as you can, and then amplify that message out there as much as you can, with smaller budgets in businesses like ours. So I will just share a bit more about this the statistics here. Today, actually, yet another go-to-market case study component. Just about 2.5 hours ago, we issued a new press release about this survey. Just 2 pieces of the survey is on your screen today. The survey went out there, I should say the press release about the survey went out there just a couple hours ago, talking about the people's behaviors and attitudes about virtual second opinions, concierge care services, and the use of AI within those services. I won't go into that detail. That might be just another conversation on its own. But again, just like this little in-room poll that we ran a few minutes ago, in this case, this nationally representative survey told us that 76% of the people who have experienced a serious health condition, either for themselves, let me qualify that, for themselves or someone close to them in their family, etc., said they would consider a second opinion if faced with such a challenge. But then the next one shows those who have truly experienced that serious health condition, 71% of that considered it, but only half ultimately obtained one. And that's even, I think, to the sample that we use, that might even be a little overstated, because we know, even just from our little in-room poll, like I said, is that a lot of people don't use the same track or train of thought as they would do for any other, say, important purchase decision that they make for their households or the education of their children, or, I don't know, the next travel spot that you're going to choose. We don't show the same attention to our healthcare, even when we're indicated for major surgery, even when we are diagnosed with cancer. And there are many cases, like the one you saw, Mike Pressler avoided an ostomy bag. If any of you have any experience with a condition like that, again, for yourself or somebody around you, it is not fun to live like that. It's a really major deterioration of quality of life, if you will. And there are many similar cases when it comes to conditions like cancer and heart disease, and even musculoskeletal conditions like ACL surgery. I was joking with someone, I'm glad I've been standing up for the last few minutes right before this thanks to the coffee break, because I did have surgery in my knee without a second opinion, and maybe I didn't need to have one because it's still not going better after 2 years. It locks up on me, so it's doing better now. Anyway, so the need for virtual second opinions. So part of this is, again, as I talk through this, I'm embedding the points or the bits in here, how we go to market and how we communicate this out there. And it starts with the need for the virtual second opinions. These three things become critical to our positioning, to how we make our messaging, to how we identify people who are right for us. I will talk in a few minutes about D2C versus B2B, though the focus of this conversation here during this summit is a bit more around D2C. I will touch on the B2B component as it is very important for our business. But these three key challenges that we address in transforming the second opinion market from a underutilized afterthought, and when that happens, and mostly an in-person exchange, to change that into, thanks to telehealth and virtual care possibilities, to change that into the market that it is now. Specialty care deserts is one, misdiagnosis is one, and chronic conditions is the other. A third of the population in the US lives in a county with less than adequate access to pharmacies, primary care, hospitals, trauma centers, etc. Specialty care access, it is a real thing. Specialty care deserts, even in one of the world's most developed country, is a challenge. 80% of rural America is medically underserved. So your heart, hopefully not yours, but 80% of rural America, if they get diagnosed, say, as an example, with a heart disease condition, they may be receiving treatment from a primary care physician. And that's the reality of the situation. The US projects a shortage of 40 to 100,000 doctors, and a lot of them specialists by 2030. Virtual second opinions, admittedly, either via the Clinic by Cleveland Clinic or some other players that are also out there who are working in the change or the transformation of the market as well. Virtual second opinions provide access to them, to the specialists who are the best in their fields. I didn't start this presentation by saying Cleveland Clinic is world's #2 hospital and also #1 hospital for cardiac care for no reason. There is a reason why it is so easy and accessible even for you right here. I shouldn't say even for you, but now you get to hear it from me. But like, it's easy for you to, when you have, or your parents or your children, whomever, have a challenging condition like this, to be able to be seen by a Cleveland Clinic physician within days. And that's a major, major transformation opportunity for the marketplace, because maybe you caught it when the Mike Pressler's story on the video that you just saw showed on screen. The main proposition, the main positioning of the business is priority access to Cleveland Clinic physicians for virtually any condition. That's it. Priority access for virtually any condition to the world's best healthcare expertise. Another challenge that we address to transform the second opinion market is misdiagnoses. Guys, it happens so much more than we think it does. We do have trust in our healthcare professionals, in our doctors, in our specialists, and there's nothing wrong with that, obviously. But there is something to say about expertise and deep or sub-level specialization by a doctor when you are faced with a critically important condition. 12 million US adults each year experience a diagnostic error. 1 out of 10 people with cancer, infection, or vascular events is misdiagnosed each year and more. So you are likely, highly likely, to experience misdiagnosis yourself in the years ahead of you, regardless of the condition that you may be in the future suffering from. So a virtual second opinion by Cleveland Clinic can offer access to these physicians with that deep level specialty expertise. It can help in the fixing of diagnostic and mistreatment errors, and it can result in hospitalization or surgery avoidance in many cases. Just 3 weeks ago, I completed what we call an ROI study, better known as a VSO impact analysis, if you will. And I will share that. But a lot of the cases that come our way to Cleveland Clinic physicians, because the reason you have a second opinion is you either want to confirm a diagnosis or you want to see again, just like think about the boiler story. You want to know if your boiler is the problem. And if that's the problem, you want to know if you should change the boiler or get it fixed. And if that's the case, is that the right thing for you? Like, is this the right guy to change my boiler? Or maybe should I get another quote from someone else? It's the same thinking, but for you, for your health, being an advocate for yourself. Misdiagnosis is a very, very important problem. Again, not to say that every doctor misdiagnoses. It happens. It is much more important if it is for complex health conditions, like, again, major diagnoses or indications for surgery. So I have one more video for you guys. If nothing else, I will have convinced you guys to get a second opinion after you leave here, and then there's a strong business case behind that as well. Let's watch this story.
Well, first he had told me there's nothing I can do with your heart while I was still getting the test. There's nothing I can do with there. About 2 hours later, they let my husband come into the room, and he just bluntly looked at me and he smiled and he said, "You need a heart transplant, or you have a 50% chance of living the next 5 years."
She had called in. She was very nervous about her diagnosis and wanted more information about a second opinion. I had scheduled her right away with Ina Fedorchak, which is a wonderful nurse, for an intake session.
The day of her intake with me, she was anxious, she was nervous. She received a diagnosis and she received news that was hard. She needs a heart transplant. So she decided to come to Cleveland Clinic for a second opinion.
Why would a cardiologist tell you that you need a heart transplant if you don't?
I listened to her, we requested her records and did get her records in a timely manner. Dr. Mountis did complete a second opinion.
They set it all up, and everybody I spoke to was so kind and so nice and so patient with me. I just immediately felt I was in good hands. My husband and I were both extremely nervous because, I mean, you know, I didn't know what I thought I was going to die. Then she just smiled, and then she told me that I didn't need a heart transplant. I'm sorry. That she saw nothing in my record that said I had less than a 50% chance to live.
And then when I found out that she didn't need a heart transplant, I was so happy for Miss Pridmore. I just cannot imagine how relieved she felt when she found out. So I'm thankful she came to Cleveland Clinic.
All right, not to down us about this whole, about these patient stories, but again, that is the primary reason for why virtual second opinions exist, to give people access to the world's best healthcare experience. And chronic conditions, we already touched on that a little bit with these two videos and examples even. All right, another poll question for you. What percentage of expert second opinions recommend a change in diagnosis or treatment plan, would you guys think? It's all good. Any of them would be surprising, right? Any of the numbers here would be surprising because, yeah, we just talked about 12 million people being misdiagnosed each year in the United States. But like, if you think about this, any of these numbers from 21 up to 67% would be surprising, and it is 67%. So this is our experience over the last 4 years of being in business, offering this second opinions to the patients out there. So it is a change in diagnosis and or treatment path. So it might be just like the extreme example of Michelle. Do you need a heart transplant? There is nothing that indicates you need a heart transplant. That's an extreme example, a change in diagnosis and clearly a change in treatment path. So, and then there's a spectrum of that, of course. Or in my case, like I had a minor lesion in my right breast, and I was indicated for surgery just a few months ago. And I'm like, I need the peace of mind. Do I need to have surgery, or can I avoid that? And I had a second opinion myself from a specialist, and then they said, if you were my patient, I would do the exact same thing. Go ahead and have that surgery. I'm like, okay. And then, thankfully, that's exactly what I needed, and I got the surgery. So I embedded these messages of how we go to market, what we use to transform and change this underserved, underthought business or segment of healthcare, if you will. There are a few things here, and I would love actually some thoughts on this, because this is not, again, a story of how we advertise, how we find the most efficiency in our ads, how we find the most, identify the best targets, etc. We do that, but with smaller budgets. There's a lot of the focus goes on how we communicate this non-reimbursable service. It is a non-reimbursable service, and that's why we work with payers or health plans to incorporate that into their benefits offerings. But we utilize the more traditional approaches of the integrated, earned, owned, and paid media. One of the things that I think spoke to already is I don't, in this business, need to spend any time on top of the funnel in generating awareness or trust in the brand to the service, right? Cleveland Clinic already does that and has that. It's one of the most trusted healthcare brands, again, not in the US, but in the world. So I leverage that to work on the bottom of the funnel. So I am there right when people need us. It is more like behavioral health. If any of you worked in that, I spent some time in the behavioral health space. You don't think about this until you actually need something. So know where your patients are, know where your consumers are and where they consume media, and show up where they are. In this case, it is very much down the funnel with search ads and some display opportunities. No TV. I don't have any budgets, although I'm very excited about hearing some of the options over the last couple of days. I might change my mind. And there's definitely a component of the earned media, working with strong partners like Insena, like I mentioned, to get stories like that out there. Then it does the trick on its own. In terms of channels, there was a great speech yesterday. I think, Dustin, I think it was you, if I remember correctly. There was a talk, you had mentioned that don't see this as a different channel. Was it like, that's how it was. Like it is really how your patients want to reach, or patients or your consumers want to come to you. There are different options, so you don't see it as how do you make this an incremental opportunity versus just growing, say, digital sales of this. In this case, there are similarities here. Our current highest volume and share is the direct-to-consumer business, and will continue to grow because there is so much need out there. If I have not done that job already with you guys of convincing you that there is an opportunity there, shame on me. But there's definitely a D2C growth opportunity here. And then the rest of our business is with the B2B segment. We work with health plans to position this. And the case here specifically, the best way to transform this market into what it is, or what it will be even more in the next 2 years, actually a bit major transformation coming up even more, is to talk about the value that it brings. I have never worked at a business, admittedly. I worked in multiple beautiful, great products and developed a lot of things, communication products and the like. This is one of those things where there is absolutely very visible win-win-win-win for all the stakeholders in the chain. The patient wins because you may be avoiding surgery, or you'll definitely get better treatment. The doctor wins if you're the doctor referring this to a patient, or if you're the doctor who's seeing this patient, you win. The health plan wins because there's cost savings, and I completed a study, just like I said, 3 weeks ago, and it shows across the board about $10,000 of savings per member in a health plan. So when I sell this to a health plan and say, hey, even for your 100K lives client, up to 5 million members if you can give me a more general access to your member base. The savings is about $10,000 per member. And it's amazing. It's because of that 67% number, right? And 67% number translates into savings. Again, win-win-win health plan, the employer, the patient, the doctor, the business, and everybody wins. And that is an exciting story and a not so hard one to tell in the marketplace. Thank you, everybody. Growth story. You got it. Thank you. Appreciate that.
Gokce, thank you so much. I love just speed through the graphs that are up and to the right? That's what everyone wants to see. I don't know about you guys. I'm like shook by some of those stats, and I feel healthy, but now I'm really questioning if I am in fact healthy, so I'm going to have to figure out how that works. But questions for Gokce? Yes.
Yes.
I had the opportunity to be part of your circle yesterday, and I was so inspired by everything that you shared. And I just want to acknowledge how incredibly thoughtful and what a model you are for everyone here. I really am moved completely by the work you do and how you shared it with everyone. So thank you.
That's very kind. Thank you. Thank you. Thank you, very kind. My God.
Yes.
Yes.
Hold on. We need your mic. And let's introduce ourselves.
Stuart Davis, CSL Bearing. Your slide, the 67%, how does that break out? That's very interesting. Like from getting the diagnosis wrong versus the treatment wrong. Do you know how that kind of breaks out?
I do have it even by condition, by age group, by all the stratifications I'm happy to share if that is of interest to you, absolutely. But it is how it works. That's a total number. So there's a diagnosis change component, there's a treatment plan change component. So it is either a diagnosis or a treatment, or I should say, a treatment change is 67%. That's based on our complete 2003 the cases that we have completed in 2003, and we finalized this study just a few weeks ago, like I said. But yes, that's how we calculate that.
Right, one more question.
Hi, Jared Posmentier from Nativo, and just a question about sensitivities of working with doctors, because you said you are targeting doctors. You're kind of calling into question, hey, sometimes they get it wrong a lot, but you're working with how did you deal with all of that?
Facts and data speak for themselves. We don't go to any doctor. Actually, great segue. I interacted with a couple of you, like Mark from Heart Media as well. My next plan for 2024 is so far I have not outreached to or created a campaign or a strategy around working with healthcare professionals. By the way, they don't like being called healthcare professionals. Did you guys? Specialists told me, we don't tell anybody, but we would like to be called physicians and specialists, not healthcare professionals. That's another story. I don't have that formulated yet. It's a plan for me for Q3 and Q4, but it's all in the data for what I do so far via earned media, owned media, and some direct communication. It is all around like this happens, not so much like you are misdiagnosing people ever, obviously, but this is a fact. It's not even our study. It's published studies around misdiagnosis in the U.S. and the associated costs for the whole healthcare system overall. So it's really not a hard story to tell. But it's not like you don't know what you're doing, come to us. It's not like that. I was a bit less tactful maybe in sharing that comment here for purpose of impact. Other questions or thoughts?
Two truths and a lie. Okay, kidding, nothing.
But
that was a dinner.
Okay, guys, I am so mad that I have not been part of this group before. Okay, like I don't know how that happened. My network of people did not get me in connection with these people ever before. But like Leslie and Erin, thank you for that. It has been so fun, just learning overall, and also just fun last night. I have so much to tell. At some point, I even found myself doing things that I don't do in professional environments. I challenged Bradley into hand wrestling contest. No, arm wrestling, sorry. Arm wrestling contest. And I was showing my guns at them, and I'm like, that's not what is supposed to be here, but it was a fun event. So thank you guys for putting that together. It was very wonderful.
Gokce, thank you so
Thank you.
much.